Hi, Ray. Dr. Sean Casey here, answering your questions at Healthcare Complete Back and Neck Pain Center. We had a few questions lately about scoliosis, and there's a little bit of confusion on the subject, so we wanted to cover just the basics with you. Scoliosis, as our friend here is showing us, refers to a side-to-side curvature. Scoliosis always sounds like a tough, scary word, like it's some type of parasite, but really, it just means side-to-side curvature. Does it mean it's genetic, that you're born with it? If mom or dad had it, you'll have it? Not necessarily. In some cases, the genetic forms of scoliosis come from when you're actually an embryo. As the cells divide, they don't divide correctly. So instead of having a nice rectangular squared off vertebrae, it's wedge shaped. So because of that, it's going to force the spine to curve a little bit. And as you notice, the spine always comes back up because your brain is trying to keep your head over your shoulders and your eyes level. And that's why we'll see someone with a curvature doesn't walk like this typically. They'll get a secondary curve coming up to bring them upright. The more common form of scoliosis is when a joint gets out of alignment, whether it's the pelvis, even the hip, knee, low back, or one of the joints in the back. Your brain wants to protect you, so it tries to lean you away from that point of irritation. You've probably noticed this if you've had like a rock in your shoe, you'll lean away from it subconsciously, or even if you had an upper back problem, maybe coming forward this way. Well, it can occur sideways as well. And if it happens for a long enough period of time where those bones don't get correctly back into alignment, the body will try and stabilize it in that position, where it'll actually shorten the muscles and shorten the ligaments to make it nice and stable. But now we've got joints that are not working the way they're designed to. And that sets us up for damage and degeneration, not to mention a lot of aches and pains, which we get a lot of calls about. So if you had someone ask you about your scoliosis, if you know you've had one diagnosed in the past and not really sure how it's affecting your health, give us a call. We'll be happy to answer your questions. Have a great day.